If you don't feel like watching an entire video, here is a really quick version of it. Basically, stretch marks appear when your skin is stretched faster than it can keep up with. What then happens is that microscopic tears take place in it, through which blood seeps out to the top, becoming visible as these reddish lines that tell of a fresh stretch mark. Your best bet of getting rid of one of those stretch marks is treating it when it's still fresh with a moisturizer and soft massaging. When the stretch mark already is older and has this white look, a bit like a scar, then your only chance of getting rid of it might be through actual surgery. And now for the longer version. Basically, your skin consists of several layers, and about in the middle of it sits one that is called the connective tissue. The connective tissue is like a flexible wire mesh that keeps your skin in form. Through the connective tissue and beneath it run veins that transport blood and nutrients to the upper layer. Beneath the connective tissue is the fat layer and the muscle layer. Now, what happens when you gain a lot of muscle very fast, or if you gain a lot of weight very fast? Then the muscle mass increases or the fat mass increases, and the connective tissue might not be able to keep up with it, gets overstretched and bursts. And in the process of this bursting, some of the blood vessels running along there as well might be damaged too. Blood seeps out from them, reaches the upper skin layers and becomes visible as these reddish streaks that make up a fresh stretch mark. Your best bet in treating them is when they are still fresh, have this reddish color, and you can then with a moisturizer and soft massaging go and aid your skin's self-repairing process. In many cases then the stretch mark should disappear. When the stretch mark already is older and has this whitish look to it, kind of like a scar, then unfortunately there is very little you can do about it outside of actual plastic surgery, because the damage sits so deep. And what is usually done here during plastic surgery is that the affected piece of skin is simply cut out. But then again, that of course is not possible for every area of your body. So where that usually is done is for women who had a baby and have the stretch marks on their lower abdomen, and they get a surgery called a tummy tuck, where the skin above the stomach is pulled down and taut again, and the excess skin where the stretch marks usually are is then simply cut out, and then of course the stretch marks are gone with it. Beyond that, there also is laser therapy, but for older stretch marks there is only a 20 to 50% chance here that it will make the old stretch marks less apparent, but usually laser therapy can't make the stretch marks that are old disappear completely, and also laser therapy is rather expensive. Finally, one word about these various products out there that promise to get rid of stretch marks. These products usually only work very well when indeed the stretch mark is still fresh, and to my knowledge then it makes little difference which of these products you use, as long as it's moisturizing the skin. And this concludes this video. As always, thank you for watching, and if you have a stretch mark here and there that you can't make go away, then please remember that you are more than a couple of lines on your body, and I wouldn't worry that much about it. As always, thank you for watching. Until next time, bye bye.